There's something important I want you to understand right from the beginning. Several of the medications I'm about to talk about don't require a prescription. You can walk into a pharmacy and pick them up in minutes, and that's exactly why they can become a problem over time. When something is easy to access, we stop thinking of it as something serious. We assume it's harmless. But after the age of 70, the body processes medications very differently. And that small assumption can quietly lead to much bigger issues. Here's what often isn't fully explained during a short doctor's visit. As we get older, the kidneys filter substances more slowly. The liver doesn't break things down as efficiently as it once did. And the brain becomes more sensitive to certain compounds, especially those that affect sleep, mood, and memory. So a dose that once felt completely normal can now stay in your system longer. It can affect balance, thinking, and energy levels in ways that are easy to overlook at first. Today, I want to walk you through 5 common medications that many older adults use, often without realizing how their effects may change with age. These medications are also listed in what's known as the Beers criteria. This is a widely respected medical guideline used to identify medications that may not be ideal for older adults. This isn't about fear, it's about awareness. And more importantly, it's about knowing what to do if any of these are part of your routine. Let's start with the first group. The first category includes medications often used for anxiety and sleep. You may recognize names like Xanax, Valium, Ativan, or Klonopin. These medications can feel helpful, especially in the short term. They can calm the mind and make it easier to fall asleep. And that's exactly why they are so commonly used. But as the body changes with age, the way these medications behave also changes. They tend to stay in the system longer, which means a dose taken at night may still be affecting coordination and alertness hours later. This becomes especially important during the night or early morning. Even a simple trip to the kitchen or bathroom can feel slightly off balance without you realizing why. Over time, these medications can also affect memory, focus, and overall mental sharpness. That doesn't mean they are always inappropriate, but it does mean they require careful use and regular review. If you or someone close to you is taking one of these medications, the most important step is not to make sudden changes. Instead, I recommend having a calm conversation with a healthcare provider about whether the current dose and frequency are still appropriate. A gradual, supervised adjustment is often the safest path if changes are needed. Now let's move to something that surprises many people. The second medication is something millions of people use without a second thought: diphenhydramine. You might know it as Benadryl, or as the sleep ingredient in products like Zizquil, Unisom, or nighttime pain relievers. Because it's available over the counter, many people assume it's completely safe to use regularly. But here's what's important to understand. Diphenhydramine affects a chemical in the brain that plays a key role in memory and learning. When this effect happens occasionally, it may not be noticeable. But when it becomes a nightly habit over months or years, the impact can build up. Some people begin to notice subtle changes: forgetting small things more often, losing track of conversations, feeling mentally slower than before. These changes are often attributed to aging itself, but sometimes medications can be part of the picture. I've seen situations where, after reviewing medications and making adjustments under medical guidance, people notice improvements in clarity and focus over time. Not overnight, but gradually. That's why it's worth paying attention to something that may seem so simple. Now let's talk about a medication many people rely on for physical discomfort. The third group includes common pain relievers like ibuprofen and naproxen. You might know them as Advil, Motrin, or Aleve. They're often the first thing people reach for when dealing with joint pain, back discomfort, or inflammation. And for occasional use, they can be helpful. But when used regularly after 70, the situation changes. The kidneys, which help filter these medications, are not working at the same capacity as they did decades earlier. So the medication can stay in the system longer and place more strain on the body over time. There's also the effect on the stomach. These medications can make the stomach lining more sensitive, especially with frequent use. And for those managing blood pressure or heart-related concerns, they can sometimes make those conditions more difficult to control. Again, this doesn't mean they should never be used, but it does mean they should be used thoughtfully and ideally not as a daily habit without review. If pain is something you deal with regularly, it may be worth discussing alternative approaches that are gentler on the body. We'll touch on that shortly. But first, there's another medication that's often used for sleep. The fourth medication is commonly prescribed for sleep support, Zolpidem, often known as Ambien. It's designed to help people fall asleep faster, and for many, it does exactly that. But here's something many people don't realize. In older adults, this medication can remain active in the body into the next morning. Even if you feel awake, your coordination and reaction time may still be slightly affected. This can increase the risk of missteps, especially when getting up during the night or early in the morning. There's also another important point. While this medication may help you fall asleep, it can change the structure of sleep itself. Some of the deeper, more restorative stages of sleep may be reduced. So over time, you may feel like you're sleeping, but not truly resting. This can lead to a cycle where the medication is used more often, without fully solving the underlying issue. That's why it's important to look at sleep from a broader perspective, not just through medication. Now let's move to the final medication on this list. The fifth group includes medications used for acid reflux and stomach discomfort. These are known as proton pump inhibitors. Common names include omeprazole, Nexium, and Prevacid. For short-term use, they can be very effective. But many people end up taking them for years without revisiting whether they are still needed. Over time, these medications can affect how the body absorbs certain nutrients. Two of the most important are vitamin B12 and magnesium. Vitamin B12 plays a role in nerve function and mental clarity. When levels become too low, people may notice tingling sensations, fatigue, or changes in memory. Magnesium supports muscle and nerve function, including the heart. When levels drop, it can affect how the body feels and functions in subtle ways. I've seen cases where simply reviewing long-term medications led to important adjustments that made a noticeable difference over time. This doesn't happen instantly, but with the right guidance, the body can often respond in positive ways. So what should you do with all of this information? Here's a simple approach I recommend. Start by writing down everything you currently take. Prescription medications, over-the-counter products, even occasional ones. Then bring that list to your doctor and ask for a full medication review. You can specifically mention that you'd like it evaluated with senior safety guidelines in mind. If you're dealing with pain, ask about options that are easier on the kidneys and stomach when used correctly. If sleep is a concern, there are non-medication approaches that many people find more effective over time. And if you've been taking acid-related medications for many months or years, it's worth asking whether they're still necessary and whether your nutrient levels have been checked. One important note: never stop a medication suddenly without guidance. Some medications require careful adjustment. The goal here is not to remove everything. It's to make sure what you're taking still fits your body today, because your body has changed over time, and your medication routine may need to change with it. If this helped you think differently about your daily routine, take a moment to reflect on your own list. And if you know someone who might benefit from hearing this, consider sharing it with them. Sometimes one simple conversation can make a meaningful difference.